Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Dr. Leslie Black. Welcome, Leslie.
Thank you. Thank you for having me.
Yes, thanks for being here. She's a board-certified naturopathic doctor specializing in women's health with a root cause, integrative approach. She helps women navigate the complexities of chronic illness, hormone imbalances, environmental toxicity, fertility struggles, and postpartum mental health. With advanced training in nutrient therapy, mold illness, and functional diagnostics, Dr. Black blends the art of compassionate care with the science of precision medicine. She works primarily with women who feel dismissed by conventional systems, those who are exhausted, inflamed, anxious, and stuck in cycles of trial and error medicine, and helps them reclaim vitality by uncovering what's really driving their symptoms. She is a restaurant owner, part-time chestnut farmer, and a mother of two. Her passion for healing is rooted in personal experience and driven by relentless curiosity. Whether she's supporting women through perimenopause or helping a patient recover from hidden mold exposure, Dr. Black is committed to empowering women with the tools and knowledge that they need to thrive. I love that last part of it, the empowering women. I just said that again this morning on another podcast. That's one of my favorite sayings is empowered women, empower women.
Yes.
So tell us a little bit of how you got into this. That's a lot.
Yeah.
That's a big bio. It's impressive.
Big bio, yes. Honestly, how I got into really this particular field in terms of mold illness specifically was because the clinic that I was working with in California, we had a lot of patients coming in that had been exposed to mold or had currently had mold illness, and they didn't really know what to do. And of course, some of those were women who were wanting to get pregnant and were concerned about fertility. And I didn't have anywhere to send them. And I didn't have the training or the background at that time. So I thought, gosh, this is becoming kind of a big deal, a big issue, not just in California, but really, worldwide. And so I thought, this is something that I feel like I need to do some more investigation, get some training, and learn how I can help these patients. So really, that's kind of how it started.
Okay. And I feel like you mentioned in the bio, exhaustion and other hidden symptoms, so to speak. I feel like mold is one of those mysteries that doesn't really get pointed at until you are maybe with a naturopath or a functional or somebody that's a little bit outside of your Western medicine, and kind of goes left undiagnosed for many years. Unless you go straight to them, which most, it is becoming more common for people to go to a naturopath. But why do you think that is?
I think for a long time, especially in the conventional medicine model, when we think about mold or mold exposure, it is often dismissed as, well, you're not really having allergy symptoms. You're not really having the common things that we used to think were just associated, or those symptoms were associated with mold. Like there's not other symptoms that can be associated. So for a long time, I think people were dismissed with their symptoms, or they said, maybe it's part of aging, or maybe it's this, and maybe it's that, instead of really thinking, could this be mold exposure? Let's investigate that a little bit. So at least that's been my experience with patients that have come to see us is, gosh, we've thought this could be an issue for so long, but when I brought it up to my doctor, they were like, oh, that's not really a thing. So.
And are these people that are aware that they're in situations that could potentially have mold, or is it like, I've lived in new homes for years, I have no idea that I would even have exposure to this?
Yeah.
And then it happens? Or are they like, it is kind of wet and damp where I live, I think this might be an issue?
Yeah, I've really had both happen. And I've had some people that come to our clinic, and a lot of them we're in a place they've been to a lot of different practitioners, and they've kind of done a lot of research on their own. So they say, I think I've been exposed to mold. I think this could be an issue. And we've had others that have been in new builds in an environment that they thought there'd be no way we have any type of exposure to mold, but surprisingly, maybe their new build had a pinhole leak in a pipe, during installation, or something can always occur even in those new builds that could expose them to mold. So I've really had both ends of the spectrum.
Okay.
Yeah.
Now, you and I were just talking before we got on that I just moved to Tennessee
Mm-hmm.
from California, and we're in a rental home, and there's literally no ventilation in the bathrooms here. And I'm like,
Yeah.
how are they not filled with mold? Right. And it's
Yeah.
like damp and wet. And compared to California, it's a very dry climate for the most part. So, for people that are literally living somewhere that feels like this is a potential for that, just by the state of no windows can open
Mm-hmm.
up or
Mm-hmm.
whatever,
Mm-hmm.
are there things that they can do to be proactive about that?
Yeah, it's funny that you say that because the house that we moved into also didn't have great ventilation in the
Okay.
bathroom, and they have a window that does not open. So I
Okay.
was like, "That's great."
Yeah.
So one of the things that I did personally was I would run a dehumidifier in there, like when showering.
Okay.
We ended up having a vent installed in the bathroom. Of course, that's always the best option if you can. But if you're in a rental, that's not always an
Right.
option. So you could leave the door open if you feel comfortable with that, or running a small dehumidifier in there can also help. And just when
Okay.
you're finished with your shower, open that door as quickly as you can so you can kind of get some airflow in there.
Okay. So that seems like the obvious thing for me. And or if, like you said, if there was a leak somewhere that we would
Yeah.
know, like, but what are some of the not so obvious situations that people may have for exposure to mold that could be causing fertility issues or many other issues for that matter that they haven't quite realized, like, oh, that's like we should look into this?
Yeah. So are you talking specifically about exposure in the home or different exposures
Anywhere.
anywhere?
Yeah.
So some things that I have actually seen, I've had a couple patients that have had exposure in their workplace, and they didn't realize that they were having exposure in their workplace. And so if you do work out of the home, that might be something to consider. Is there, Mhm.
And are you just looking around in your work? Like,
No,
how do you know?
yeah, how do you know?
You know?
Most of the time it's because of symptoms. They started to manifest some
Okay.
symptoms, and those symptoms can vary depending on the person. But I would say the majority start to feel tired all the time. Maybe they're having increased brain fog, or maybe they have anxiety symptoms that they didn't have before. And these are all kind of new things for them. And they've done the full gamut of a workup, looking at blood testing to make sure nothing was happening there. And so then if all of that looked normal, like now let's start to investigate some things that maybe could be contributing to your symptoms in the environment. And so that's when, we go through, usually do some testing for mycotoxins specifically
Hmm.
to see,
Hmm.
and if they're elevated, we look at, okay, is there potential exposure in the home? If not, let's look at where else you are. Right. So I'm in a workplace that could potentially have that. Maybe it's an old building. Maybe they've had a water leak in the past. Maybe the mold is coming from the HVAC system. So there's so many different exposures that can be happening. And
Right.
so it's good to kind of go through, where are they, what environments are they in on a daily basis, or even certain foods. I've had some patients have major exposure from supplements, supplements
Mm,
that contain mushrooms.
right.
And so like, okay, let's go through all your supplements. Let's make sure you're not ingesting, the mycotoxin. So
Right.
yeah.
And I know a few years ago, and probably still now, but coffee was a big thing, right?
Yes,
As far as
coffee, yes.
the toxins in
Yes.
coffee. I don't know if that's still really a thing or not. I
Yeah.
mean, again, this was probably 15 years ago when that
Yeah.
kind of hit my plate about learning about all of that. But is
Yes.
that still something that people are?
It is. Yes, it definitely is. And actually, that was one of my major exposures to
Oh, okay.
mold. So yes, it is still a thing, and luckily, there are companies that are more and more companies now are getting their certification for mold testing for their beans, and they go through rigorous testing process to make sure those mycotoxins are not there. So for coffee
Amazing.
lovers, there's still options.
I
It's
know back then there really wasn't a lot of
right.
options
No, there
for that.
wasn't. There was
So
not.
that's good to know.
Yeah.
So again, fatigue and inflammation,
Hmm.
um, brain fog, those are pretty general
They are. They
symptoms for a
are.
lot of things,
Yes.
right? And I think
Yes.
that especially if you've had kids or maybe you're trying to have kids,
Yeah.
it's like I know for myself, even post kids, it was like, well, of course I feel all that. I am not sleeping. I have three young kids. And,
Yeah.
at what point does the scale tip for you to say, no, there might be something else going on? It's not just lack of
Lack of
uninterrupted
sleep.
sleep. You know what I mean? That
Yeah, yeah,
there's something more.
there is, and there's lots and lots and lots of symptoms that can be correlated with mold exposure. And so usually what I do is we'll go through a pretty exhaustive list of things and say, okay, are you experiencing these things as well? Most of us are probably experiencing some level of fatigue, as you know, brain fog probably. so, so there's lots of other symptoms that if a lot of those are present, then we think to ourselves, this might be something that we want to investigate. And again, if they're in maybe a home that they say, and this is a question I always ask, has there been a potential water leak? Has there been a potential exposure here? And if they say, you know what, yeah, actually, we did have a water leak. So then, if we're looking through environment, a whole gamut of symptoms, and if again, a lot of times they've looked at other lab testing or other potential conditions that can be associated with these, and those were ruled out, then we're kind of digging a little deeper here and saying, okay, this might be worth investigating.
Okay. So next thing is, how does the mold exposure correlate with fertility issues?
Yeah, so this is a big one, and I want to be careful what I say here because yes, mold can, as what we know from research is mold can contribute, to potentially issues with fertility or infertility. Um, it cannot be proven yet to be a standalone cause, but it definitely can contribute. So one of the biggest ways that I see this happening is hormone dysregulation. So we may have a particular mold exposure. This particular mold may produce a mycotoxin. So, for those that don't know what a mycotoxin is, it's a basic toxic byproduct of certain mold. And so when we have something like that present, it can disrupt our hormone balance. So we can see higher levels of estrogen or maybe lower levels of progesterone, and that disruption in our hormone balance can obviously be something that just is difficult for us to conceive when we're having those disruption. And then we can also see it affecting our thyroid health. And I know you've talked about this several times on different of your podcast episodes. It can disrupt thyroid. And I've actually seen this clinically several times where we may have someone that initially has normal thyroid readings. And then after a exposure, we can see presence of maybe hypothyroidism or Hashimoto's, so that can definitely be a direct impact, to that thyroid. We can see adrenal health being affected by those mycotoxins as well. So the foundations, we're looking at major things that can impact your ability to conceive.
Okay. So then what would the protocol look like to help us get to a
Yeah,
point where we can conceive and kind of
yeah.
make sure we're eliminating those to the best of their ability?
Sure. So usually, again, we would do a mycotoxin test just to see, is there presence of mycotoxin there, and if so, in an ideal world, we would be able to detox that prior to conception. And most of the patients that I work with, that is what we do. So if we're thinking about, all right, I want to conceive in this amount of time, and we have a good window to be able to detox that out of the body, and that looks various different ways depending on the mycotoxin that's present. So some of those things would be, antioxidants, um, whether that be in supplements or our foods. Certain foods are really really wonderful for detoxing mycotoxins. We can look at just sweating, sauna, hydration, elimination, making sure we're having bowel movement every day, we're drinking plenty of water. So those are just kind of basic things that we can do. Yeah.
And I want to just caution people who are listening, because I think oftentimes they'll Google what does a mold detox look like,
Yes.
and then oftentimes those are pretty taxing on your
Mhm.
body, especially if you're trying to conceive.
Mhm.
So I would warn against doing that and work with a practitioner to help
Yeah.
you work through a proper protocol to detoxify your body appropriately for what it is specifically that you're working for, because your body can essentially go into shock when
Yeah,
you're trying to
absolutely.
detox something.
Mhm.
So beware of that.
Yes, yes, yes. Google in this case is maybe not your friend.
Right. So, what are some of the subtle signs that may not be so obvious, like the inflammation and the chronic fatigue and things like that? What else should somebody look out for to to see something else is going on?
Well, again, this is so individualized because every person may have a different reaction to a particular mycotoxin. I've had patients have they'll say I have this strange symptom where if I scratch my skin, that scratch basically stays on my skin for hours. It looks very strange. So dermographia is one of those that we can see. We can have chest pains, joint pain, muscle soreness, sinus symptoms, a lot of sinus congestion that just does not go away, when being treated.
And do most people, when they do a protocol to detox their system, do they like all of a sudden like, oh my gosh, I can finally breathe, I didn't realize I couldn't breathe, or I'm not having
Right.
chest symptoms, or
Yeah.
is it pretty much like a light switch goes off, or is even the recovery, so to speak, subtle as well?
Yeah. It does depend on the person and their immune system. Like how compromised is their immune system? How are their detox pathways? Are they able to detox pretty well, or is it slow clearance? So I've had patients start on maybe a nasal spray that we're targeting some colonization in the sinuses, and they start within a couple of days. Like, oh my gosh, I'm not having that congestion. I'm not having those sinus headaches that I was having before. And then I've had others where it takes months, to see a
Okay.
result. So it really is so dependent upon the person.
Individual.
Yeah.
Yeah,
Yeah.
I know. It always sounds so cliche to say
I
that, but it's
know.
so true.
In this case,
And you
it's
want
very
that to
true.
be true as
Yes,
well,
yes,
right?
yes.
Because I think when doctors tell you it's going to be, 30 days, this is going to happen,
Yeah.
you kind of have to start to wonder, because everybody's body is different.
Yes.
I
Yes.
have my own issues, somebody else has something else. So
Mhm.
the combination of what you're doing, of course, it's going to be different and should be different.
Yeah.
So I would just caution, if
Yes.
somebody's reading something that says
Yes.
this is going to happen within X amount of days,
Yeah.
to just be aware of that.
Yeah.
But those subtle indications, I think, are the hope that you're moving in the right direction, whether it
Absolutely.
happens overnight
Yes.
or it takes a while.
Yes, and you're absolutely right. The subtlety of the changes in those symptoms, and that is that's very very relevant for something with mold because yeah, there could be maybe I slept through the night and I haven't slept through the night in months. Just little things where you start to see
Mhm.
improvement.
Right. So, women and the whole holistic approach to women's wellness, what specifically got you kind of down that path as well? Because I think that in and of itself is also a niche market,
Yeah,
in this industry.
actually. I'm going to just point to a personal experience, which I'm sure a lot of
Okay.
people do.
Yeah, of course.
Probably honestly, my interest in this happened maybe 20-ish years ago when I myself had a chronic health condition. I had a seizure disorder, really of just unknown origin,
Oh,
and
scary.
it was very scary. And I went through the conventional medicine model. Went to neurologists, went to some of the best neurologists, and no one could really give me answers. And I kind of really, as a woman at the time, felt like, oh, this could just be maybe your hormones are changing. It's really not that big of a deal. We don't really have an answer, but here's the medication and you're gonna be fine. And I didn't really love that. I didn't love how it felt. I didn't love the feeling of being dismissed. And I sought help out of desperation from a naturopath. not a naturopathic doctor, but a naturopath. And she just completely changed my outlook on how, number one, we should be addressing health, and even as a woman, and the questions that she asked me. And it was a very much a holistic approach, and the way that she was going through symptoms, or just assessing my whole issue as a person, mentally, spiritually, physically. And I'm like, oh my gosh, this is so different and new. And it felt good. And I remember the day after I met with her, number one, I didn't feel as afraid anymore. And number two, I felt empowered to take control of my health. And then I thought, I want to do this. Like, I want to help people feel this way. And so that's really where my interest started. It took me a very long time to get here, all of the schooling and completely different direction that I was going in at the time. But that is really when I decided this is the most amazing feeling I've ever had. And I want to do this and help people.
That's awesome. I think that the whole aspect of a different avenue, so to speak, from the traditional medical doctor is really opening the eyes of patient care to know that there's more than just one way of thinking about things. And almost if we don't look at our bodies in a holistic way, we're doing ourselves a disservice.
Mm-hmm.
And no offense to the medical doctors, because there's certainly a need for where they are and what they do as well. But, they're really taught so specifically about what it is that they're specializing in, I guess, for a reason. But also, if you ask a medical doctor about supplements, they're like,
exactly.
take it or not take it.
Right.
I don't. And to be fair, they're not taught about that, so okay, that's fine. But I feel like we're no longer in a state of a place where we can't not integrate all of these other opportunities to help heal our body in different ways.
Mm-hmm.
So if somebody's listening and they've only been seeing a medical doctor about one thing or another, give us some insight on what a naturopathic doctor can do and help them to understand that.
Probably the biggest difference that I see is the time that we spend with patients, because in that conventional model, they don't have a whole lot of time to spend with patients, and that's not their fault. Obviously, it's kind of how that's set up. But when you're meeting with a naturopathic doctor, we usually have a lot more time to spend and to really talk through your concerns and really figure out what are your goals, how can we reach those goals, what feels comfortable to you in terms of what your treatment plan is going to look like. It needs to be a situation where you're working together, that partnership, and not just someone saying, here, do this, and I don't really want to hear what you have to say about that. So I think that's probably the biggest thing. It's more of that partnership.
And nowadays I feel like patients are so educated, right? And they know a lot about a lot of things. And it's no longer really just, here's the person in the white coat and I'm going to believe everything that they say. They might say, I read about XYZ and I want to try this. And I think we also, as educated as patients are, I think we still also need to understand we're partnering and want to feel aligned with that doctor, but also they are educated in this, more so than just reading something online. You know what I mean? And I think sometimes I see patients really feel strongly about what they need to do, and that's great. But also there is something else on the other side of that I just encourage patients to still stay open to the feedback that might not be the way for you, even though you have learned about it and that.
Absolutely.
And the time spent with a naturopathic doctor, especially when you're going through something like fertility, where it's most likely not going to be a one and done type of relationship with that practitioner, is really, really important, because this is arguably the most important thing you're ever going to do in your life.
Yes.
And so regardless, you're setting your body up to be clear and in the best state possible to then conceive and have your children carry on whatever state your body's in at that time.
Yes.
So I think sometimes people can get overwhelmed when they do see a naturopathic doctor of like, oh my gosh, now I have to do all these things, or I thought I was going for this and
Right.
now it's all these other things.
Right.
But if you just take a step back and look at the big picture of your life and your body as a whole and how this is serving you, I think it all makes sense. And just be patient with the process, I think is really helpful. Even because I'm not one of those people that sees results overnight really on anything. And so that can be frustrating when you're putting a lot of work into something. But knowing that in the big picture and the long haul, like it's making a difference and it will pay off. I just always tell people stick with it and know that it can't not be doing anything, right?
Yes.
You're moving the needle somewhere.
Yes.
It may not be recognized at where you're at on a physical space, but just try to be patient with that.
Absolutely.
So what do you recommend for patients to do when they may not be seeing the results that they want to be seeing and they've been at it for a long time?
Yeah. Celebrating the small wins, and that's what I do with my patients. I'm like, but you started here, but look where you are now. Even if it feels like, my gosh, this is taking so long to get to the end goal. But those small wins along the way, those are huge and they should be celebrated. And the progress that they're making and the time and the commitment, that's a big deal. It's a big, big deal. So I do that all the time with my patients. Like, hey, let's celebrate the fact that this happened, or you're not having this symptom anymore. It's amazing.
That is amazing.
Yeah.
And I think the small changes add up to big results in the end.
Absolutely.
Right.
Absolutely.
And it doesn't always have to be this huge life-changing event all the time.
Right.
So you're a restaurant owner. Let's hear about this. I want to know more. How did you get into that?
Well, I know.
I know you're
not
trained in
expected.
nutrient therapy. Is that any
Yeah.
relation or?
Well, in a way, yes. My husband is from Italy and he is a chef and has always wanted to have his own restaurant. And we've talked endless times about nutrients and just how nutrition can impact your body. And he went through something very scary a few years ago, and at a young age was diagnosed with cancer. And so, of course, but that was a chance for us to really dive into that nutritional aspect and all of the tools that we could use, to help with that. And so, since then, he's decided, what, I want to have my own restaurant. And so we have an Italian pizzeria, which I know when people say pizza, it's like, oh gosh, that's not very healthy. But you know what? If food makes you happy, then yeah, it is. If it makes you happy, then yes, it can be medicine. And we do import all of our ingredients from Europe because they have some cleaner products, and so we do try our best to keep it healthy. But I have to say that the happy part is where a lot of this comes in.
And it's so true. Honestly, years ago when I was doing some work around weight loss with patients and things like that, that was one of the things that we really focused on. And you would see, you look at Italians or French or whatever, it's the true love and happiness for the food that causes them not to gain weight, So if you could just like really get into that and be like, oh my God, this pizza is amazing. I love it so much. Right.
Yes, it is.
And just focus on that.
Yeah.
It really shifts the physiological part of your body to be like, okay, this isn't hurting me. Like, this is great. This is making me happy. And I love this food and whatever. So I'm 100% on board with that. That's fun. I'm sure that's an adventure in and of itself to be involved with.
It is. It's a lot of fun, though. I have to say, it's definitely been an unexpected joy, I'd say.
That's great.
Yeah.
And if you could wave a magic wand to fix any of the common symptoms that you see, what common symptom would that be that you would want to fix?
Oh gosh, common symptom. I would say probably majority of what I see and experience myself would probably be fatigue, the fatigue. And that can come in all shapes and sizes, really, depending on the person. That's probably the one that I see 100% of the time.
Yes, sign me up.
Yeah,
If
right?
you could wave the magic wand my way,
Yes,
yes,
have
please.
endless energy. You're not to have to experience fatigue, on a daily basis. That probably
Yeah,
would be it. Yes. Yeah.
because I feel like for me, it's so hard to know, like, is there something going on, or is it just that, someone woke up last night? I mean,
Right.
with between the three of them, somebody's always waking up about something.
Yes. Yes.
So yeah, I would love that. I keep thinking it's not going to be like this forever.
No.
We'll get back
No.
on track eventually, but we're definitely still in it.
Yes.
So, well, thank you so much,
Yes.
Dr. Black, for being here.
Yes.
It was so nice to chat with you.
You as well.
And I think we've all learned a lot about just our awareness of the environment that we're in, and how that can affect us, not only with fertility, but in other ways as well.
Mm-hmm. Absolutely.
Thanks so much.
Thank you.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.